Good evening. I am Scovia Achiro. Welcome to this unit. I work as an in charge. Once again, I want us to feel free on this word. And in this unit, we have patients who are terminally ill. And when I say terminally ill, I mean patients who are they have chronic conditions like especially cancer cases. Yeah, that is the type of patients we have here. And the care we give here is the care that we give to, especially the care we give here is the care we give to the terminally ill patients, those ones who are in their end stage of life. So this care that we give here is very different with this other normal nursing care that they give in these other departments and units. As I would like to bring to your attention that most patients who are here, they have chronic conditions, as I told you before, and most of them, their major concern always is pain. As I know very well that before coming here, we were taught about pain. Pain is what the patient says it is. You should not underrate pain. You can see someone smiling, but the person says that, I have stomach ache, I have headache, I have joint pain. So you should take it as the patient says, the way he or she feels. So here we deal with such kind of patients, meaning as we are here, we should concentrate on assessing pain and managing the pain and making sure that the patient is comfortable, or at least you try something to make the patient feel better, fairer, not like the way they came. In managing pain, we start with the assessment. You assess the type of the pain the patient is suffering from. Pain can be psychological, can be physical, can be emotional, can be spiritual. As I told you earlier on, that patients who are here, they are people who are in their end stage of life, most of them. So they have this burden in their life, like emotionally, they feel like people are tired of them, they're overwhelmed. Family members are already spending a lot on their treatment. And then too, spiritually, someone might think that maybe what they are suffering from is a punishment from God, or is a curse. As they say, cancer is genetical. They'll be like, maybe our family lineage did something. That is why what? We are suffering like this. That is why I have this. That is spiritually. And then physically, you find that the patient will tell you that I have pain here, maybe at the joint, at the back, or where maybe those ones who have cancer of the breast, they will be saying that I have pain on my chest, pain in the breast, and so many, depending on where the patient says the pain is. So you need to assess the type of the pain the patient have, and then after assessing the pain, we also go to see the level, how deep the pain is, how it is interfering their daily life. Does the pain stop them from sleeping? Does the pain stop them from interacting with their fellow patients or doing their daily activity, like maybe brushing, cleaning themselves, and so on, or eating? After finding out, there are tools that we use for assessing pain. Uh, we have a numerical scale which is rated from 0 to 10, whereby we say from 0 to 3, mild, no pain, 3 to 5, mild pain, 5 to 6, moderate pain, and then 6 to 8, severe pain, then 9, 10. Those are now pain which is overwhelming. Uh, those ones, that scale, you use it to assess those patients that are able to express. They can talk. So you first show them that from this to this shows this. You explain to them. Then now you start pointing and they will explain to you. So after assessing and seeing where the pain is, that is now the time you can decide which analgesic you can give according to the analgesic ladder. And if you use that kind of assessment, believe me, you'll never go wrong on this word. And then another scale also, we have the Wong-Becker scale that uses the face. That one we normally use it for children. There is the one you have that the child is smiling. That one means that there's no pain. Then there's that one that the smile is not that much. You show the child and explain the meaning. And then there's that one that the child is gloomy. That one means that the pain is severe. So you show to the child and ask, how do you feel the pain now? They will show you. Then you will tell that it's like this. Then you also use that to give the treatment you want to give. And then also we have charts. Under the charts, we have the colors, whereby red means the patient is not in, the red means that the patient is in severe pain. Green means there is no pain. And then orange means that the pain is moderate. This one, we use it for children, and then we use it for elderly, and also for those ones who cannot talk, like they have difficulties in verbalizing, cognitive problems. So after explaining to them, you tell them, I show you this color, it means this. I show you this color, it means this. So you can now ask, as I've explained to you, you tell the patient, I've explained to you, how can we rate this? How do you feel now? They will point for you green, meaning that the patient is not having pain. Then when they show you orange, means that the patient is having moderate pain. And then now, if they show you red, means that the patient is having severe pain. And also what you should not ignore, pain differs from one patient to another. They can have the same condition, but that does not mean that they have the same level of pain. Pain comes in different ways in different patients. You can give the analgesic like now. Within few minutes, the patient verbalized pain, but you gave the same dose to different patients. There's no need saying that I've just given you. That is why in an analgesic ladder and when we are managing pain, we always emphasize that you titrate morphine, analgesic, the painkillers, the morphine, you titrate until when the patient says there is no pain. And also what you should not forget is, as you're giving those analgesics, the morphine, always give with the bisacodine, which treats constipation. And then you also give with sulfur things.